Hi, I'm Rachel Vandenberg. I'm a naturopathic doctor and a healthy breast educator with the Mama Life Foundation. And I'll be giving an overview today of the second module of the Healthy Breast Foundations program. Now, this program is designed to educate women in natural strategies that they can use to reduce the risk of breast cancer or its recurrence, to recover, or to live with chronic disease. And in the second module, we focus on getting to know your breasts. We begin the module with a discussion of the anatomy and physiology of breasts and breast tissue, and then we teach how to do a thorough and a proper breast exam, and then we educate about the benefits and limitations of various screening techniques that can be used in getting to know your breasts, and we encourage you to explore the physical, the mental, and the emotional relationship that you have with your breasts. Anatomically, breasts are made of milk-producing glandular tissue which is surrounded by fatty tissue. Resembling the branches of a tree, the milk-producing part of the breast is organized into 15 to 20 sections called lobes. Within these lobes are lobules where the milk is produced. The milk then travels through a network of tiny tubes called ducts, and the ducts connect and come together into larger ducts which eventually exit the breast through the nipple. The dark area of skin surrounding the nipple is called the areola. Breasts also contain blood vessels, lymphatic vessels, and lymph nodes, as well as connective tissue. The breasts naturally change through the monthly cycle in response to fluctuating hormone levels. So being familiar with these changes can help you recognize what changes are normal for you and what might be cause for concern. There are many ways of getting to know your breasts. One approach is to use one or more of the screening techniques that modern medicine has to offer us. Now, each of these techniques has its benefits and its limitations. And in the full module, we'll discuss these techniques in detail so that you have an understanding of the tests that your healthcare provider might recommend to you, and you'll be able to make an informed choice about which tests feel best to you. Thermography, for example, is considered very safe and non-invasive. It can detect very early changes in breast tissue by detecting changes in temperature. It's not diagnostic, so it needs to be followed up with other techniques for diagnosis. But it can, like I said, it can be complemented with those other techniques. Mammograms, on the other hand, detect calcifications and have been shown to detect about 85% of breast cancers. However, they are less accurate in smaller or more dense breasts, and they come with the risk of exposure to radiation. Ultrasounds can detect changes and are considered free of risk, but they can't detect smaller tumors and aren't the tool to detect calcifications. MRIs are generally used to follow up on anomalies that might be found in an ultrasound or a mammogram, and they too are considered to be low risk because they don't involve radiation exposure, but they do involve the use of an injection dye, which might not be tolerated well by some people. And then we have clinical and self breast exams. So clinical exams are performed in office by a care provider, and self breast exams are exams that women can perform by themselves. I find that many women are hesitant to perform self exams. And this might be for various reasons. It might be because they are nervous about doing it properly, knowing how to do it properly. It might be a hesitancy or a fear based on concerns about what they might find. But getting to know your body and your breasts is an important part of staying well or knowing when something isn't right. And I've seen many women in my practice who have discovered their own breast cancers or breast changes. And while self-exams don't have the complexity that might draw us to the more high-tech screening tools, when performed well, they can detect at least 50% of asymptomatic cancers. So they're an excellent way also for women to get to know their own bodies and are essentially risk-free. Now, that said, some people would say that the risk of self-exams might be that it can cause an anxiety. If you find something that feels unusual, it can cause an anxiety until a more confirmative diagnosis is reached. And it can be difficult to prevent the stress of finding something suspicious. But I find that women who know their body well are less likely to be in a position of that unnecessary alarm because they're familiar with what's normal to them. So we'll cover this in more detail in the full module, but for now, let's move on to how to perform a proper self-breast exam.
First, take off your shirt and bra. Stand in front of a mirror so that you can look at your breasts. Observe their shape and size. Both of your breasts might not be symmetrical. It's normal for the breasts to be slightly unequal in size and shape. Notice the skin over the breast and whether there is any puckering or dimpling. Also, notice any discoloration, redness, or heat. Squeeze each of your nipples and check for any nipple discharge. This discharge, if present, could be milky, watery, yellowish, or bloody, and may indicate a hormonal imbalance, presence of breast milk, or something more serious. Other nipple abnormalities, such as sores, peeling, crusting, or any inversion of the nipples, where the nipple is pulled inward, can also be noted. Place your hands on your hips and apply pressure. Examine the contour of your breasts, noting any areas that are either pulled in or pushing out. Slowly stretch both arms over your head. Have a look at the breasts and the underarm area. Again, looking for any areas that are pulled in or protruding out. Clasp your hands together behind your head. Pull your elbows back and squeeze your hands together. Look for any changes in the appearance of the breast and the underarm area. Bend forward from your hips until your nipples point down, resting your hands on your knees. Observe the contour of your breasts for any irregularity. This completes the visual exam. Now we'll begin the tactile exam with palpation. It is important to examine the entire breast area. Breast tissue extends from 1 inch below the breast to the collarbone and from under the armpit to the middle of the chest. Begin by lying down on your back and stretching one arm above your head. If you have larger breasts, place a pillow at your side for support. The vertical strip pattern has been found to be the most accurate way to examine the breasts without missing any area. Place your left hand over the lower outer edge of your right breast. Using the pads of the 3 middle fingers, work in small circles. Use 3 levels of pressure to feel the tissue at various depths. First gentle, then moderate, then firmly until you feel your ribs. Check the underarm area for swollen lymph nodes. Are there any present? Are they hard or soft, painful or not painful? Keep in mind that 45% of all breast cancers occur in the upper outer quadrant of the breast, so spend a little more time in this area. Lumps can occur just beneath the skin or at the level of the muscle close to the rib. Larger breasts mean deeper palpation. Breathe slowly and remain relaxed during the exam. Note what you are feeling. Is the breast texture hard or soft? Is it smooth, granular like small seeds or sand, cystic, which feels like round, fluid-filled sacs, fibrous, which feels long and stringy, or lumpy? Lumps may be any size or shape and may be soft or firm. Benign lumps are common and are usually due to hormonal fluctuations. They are likely to be smaller or disappear in the first 8 days of your menstrual cycle. If you are doing your exam in the latter half of your cycle, check again 4 or 5 days after your next period and see if the lump has changed or is still there. If you notice that your breasts are dense or have been told this by your medical doctor, visit our website at manalive.net to see our resource on how to decrease breast density, or contact one of our Healthy Breast practitioners. If you do feel something under one of the breasts, relax. When you examine the other breast, compare your finding to the opposite side. If it's on both sides, it's likely to be benign or normal. Also, be aware of any lumps or changes from your previous breast self-exams. If you feel something that is new or is just on one side, speak to your doctor about it. Now move to the area of the nipple. Feel not only the nipple, but underneath it as well for any lumps or pain. Lower your arm to your side and check for swollen lymph nodes above and below the collarbone. Now repeat the exam on the opposite breast.
Thank you so much for joining me today. For more information about the full Healthy Breast Foundations program, please check out mamalive.net.